On this episode, we'll talk about blood clots. We'll also talk about reducing medications for diabetes before surgery, and we'll also talk about eating meat with your gastric sleeve. I'm Dr. Alvarez from Endobariatric.com, and this is episode 48 of the AskDrA show. Thanks so much for submitting new questions to the show. Thank you so much. I want to thank everybody on Facebook, on the Facebook groups that have been sharing the show. We've been reaching out to more and more people out there and helping more patients with their questions. So thank you so much for sharing. I also want to thank certain groups online and certain forums that have been so kind to post the show and help out their community. So let's jump into the questions.
Is it true that flying after surgery could cause blood clots?
So does flying cause blood clots? The answer is it does not cause it by itself, but it is associated to forming blood clots down the road. So blood clots can form or are more associated to longer flights that are longer than 4 hours. Remember that what you can do to help this is once the plane reaches a 10,000 feet mark and you'll hear the bing bing on the airplane sent by the captain, it's okay for you to stand up. You can make yourself get up to the restroom, move around, go through the aisle back and forth, and it will help you. You can do this every hour, especially if you flew in for surgery. It helps you a lot to prevent this. Of course, compression stockings help a lot too, and we do recommend those.
Can we reduce insulin and other diabetes meds during pre-operation diet?
Okay, so it's important for you to know that if you're on one, two, or several medications for diabetes, it is important for you to know or let your doctor know that you are going to do a pre-op diet to get you in shape for surgery. If you're going to do this, it is important for you to know that you will be needing to reduce these medications, one or several, or getting off the insulin or reducing certain medication you take orally, because you're going to be lowering the amount of calories per day. So it is important for you to get your primary health physician, internist on board prior to starting your pre-op diet.
I have trouble eating meat. Any advice?
Okay, so remember that eating dry food like chicken breast or even a ribeye or a chunk of meat is it's difficult the first 6 months. Remember, you need to two things. If you're taking an antacid, you're doing really good. It helps. That's number one. Number two, if you cut your piece of meat in smaller pieces, or if you even decide to have ground meat will go down much simpler than a regular piece or chunk of meat. Let's say you go out to a nice dinner and you order a piece of meat, and what are you going to do? Well, number one, you order the smallest filet mignon you can find. That's number one. Take your time. You need to chew very well. Remind yourself you need to chew very well and take your time having dinner with this piece of meat. That's my best advice. All right, so that was it for episode 48 of the AskDrA show. Don't forget that the AskDrA show is now a book. We now have the book available for you. It's available on Amazon, so you can find the book there. Pre-order your book. It comes out June the 6th. You can pre-order the Kindle version or the physical book, and it's great. It's the first AskDrA show. More books will probably be needed to complete the series, but this book is great. Great information, great opportunity to get more info, more knowledge, and to get to know your sleeve much better, all right? So question of the day is, have you pre-ordered your book? The answer is yes, no, right down here. I want to hear from you. Thanks so much. I'll see you next time.